Thank you for choosing Axxess On Demand. Axxess believes in continuing education, and we create content to empower you to learn and grow anytime, anywhere. Let's get started.
Hello, everyone, and thank you very much for joining us for today's webinar, which is going to be The Future is Now, Using Technology for Growth. So very happy that Christina Andrews, our Senior Director of Professional Services, is able to join us today to share some thoughts with us. My name is Mike Carr. I work with our training and education team, and we'll be here to answer any questions that you may have along the way, but Christina will be the star of the show. So by virtue of attending today's session, you certainly are able to earn 0.5 continuing nursing education credits from the ANCC, the American Nursing Credentialing Center's Commission on Accreditation. It's quite a mouthful, so certainly the content today meets their requirements and their standards, and at the end of the presentation or after the presentation, we'll communicate with you how you can get that certificate. It'll actually be through the Axxess training and certification platform. So if you don't have an Axxess account, don't worry about that. We'll go ahead and set one up for you and communicate with you how you can receive that digital certificate. So we'll be in touch in the next couple of days with directions about any of that. But if you have questions along the way, certainly feel free to reach out to me at mcar, with 2 R's, at axxess.com, and we'll make sure you're headed down the right path with that. So take it away, Christina, and thanks again for your time.
Thank you, Mike, and thank you for joining our conversation today. So really, when we think about the advances of technology and what it has to offer, it truly has provided some relief as it relates to assisting with recruiting staff, retaining staff, as well as caring for our patients within the care at home industry. What is really top of mind, and we're going to talk a lot about today, is how the rising patient as well as caregiver expectation around satisfaction within the role and the functions of their role, and also the care delivery, that continues to increase. The expectations continue to increase. And organizations within the care at home industry are having to struggle to do more with less. So really, when we think about tech-enabled support, it really can assist the care at home industry in improving patient care capabilities, as well as streamlining operations, as we look into today, as well as the future. So based on our conversation, I really hope that you are able to identify 2 ways in which technology can assist you in improving patient care and satisfaction. And I'll just throw this out there, starting with employees first. So maybe that's a hint. And then secondly, identify 2 areas in which technology can help to bridge the gap to care. So technology, it's transforming the care at home, and how is it doing so? Truly, it's enabling us to have more remote patient monitoring, telemedicine, as well as through utilization of wearable devices. And what that's doing, it's providing innovations to the medical personnel with instant access to patient data. Prompting the ability to provide access to care and to follow up from a remote perspective. So prompting the actions that are required to ensure that patients remain in their home. Many of us, I'm sure we can raise our hand in this virtual room and say, I've had an experience to where either my family, my loved one, my community, my neighbor, wish they were able to have the care in their home more safely and or through the end of their journey. So I wanted to share just a couple of stories for us to keep in mind as we journey through this conversation today. And one actually was a story provided to me by my husband, who was a paramedic back in his earlier profession. And he was called to a home in which he found a gentleman in a glass shower, wedged kitty corner-like. In speaking with the wife, as well as the police who were there, they had found out that this gentleman had just had hip surgery, and he wanted to take a shower. However, slipped and fell, and his hip and leg locked up. So he wasn't able to bend in such a way that he could pivot and stand up. So the shower ran for quite a few hours because his wife was out, I think at a book party or some kind of tea party. So she comes home, and the husband has been in the shower for a couple of hours. The water is still running. So when we think about that particular situation, he was fortunate that he did not have an accident that, in essence, would have landed him in a hospital immediately, unlike this next story. A neighbor within my community was making lunch for himself, and during that time period had fell and cracked open the back of his skull, and as I would state, had bled out. And neighbors wondered after a couple of days why they hadn't seen him in his yard. And then finally reached out to family within the state who tried to contact him. The police were able to enter the home and found him, unfortunately, passed. And then my last story of an individual who was decorating for Christmas this past year was told, please don't use the ladder. We will help, we will assist. But she was adamant that she was independent and she wanted to do this on her own. Well, she fell from the ladder and broke her ankle. She was unable to pivot herself and to move across the living room floor to get to her cell phone. In all three of these situations, technology could have played a part in helping to communicate, whether to a family member or to the local police or emergency team, response team, or to a provider. Technology could have played a role in helping to facilitate the care that was needed and needed more promptly. So when we think about the revolution in the care at home industry, technology plays a critical component. Future advances in home health care technologies have the potential not only to facilitate the role of home health care within the overall system, but also to help foster a community-based independence for individuals. And I know that, those three individuals that I just spoke of, each of them prided themselves amongst, their ability to remain independent, but what they consider safe and what we see as safe working in the industry, is maybe two different things. So traditional telehealth, that really enables us to capture a person's blood pressure, weight. Some of the technology also fosters information about lifestyle or behavior, pretty much eliminating or kind of removing the need for self-reports, because sometimes that self-report does look and sound a bit differently than from the data that we're able to capture through the telehealth. It also can provide more of a low-cost perspective, allowing the provider or the healthcare workers to capture more information remotely because it's much more efficient, more streamlined, allowing us to also to obtain data that maybe we wouldn't have captured in the home. So when we think about technology, there's two terms that I want us to keep in mind. And the reason why I want to educate on these terms is because as we think about standing up our home health operations or our hospice operations, our care at home operations, being a bit more educated in the type of technology that we may want to adopt so we can serve our community at large is going to be important. And so this is where active and passive technology plays a part. So active home telemonitoring devices really helps us to capture, as I mentioned, the vital signs, the weight, or symptoms, and it helps pass along that data to the provider or the home health agency. Whereas passive telemonitoring technologies. This will incorporate items such as bed sensors that could capture restlessness, sleep interruptions, as well as pulse and respirations during sleep. So those two components together really help to advance the whole telemonitoring component of active technology. Now, when we think about other type of technology as it pertains to active or passive, a way also to think about it is active can help to generate alerts or reminders or lost objects. So think of your cell phone and think of your iWatch. If you're an Android, I'm not as familiar with those devices, but this is active technology that can really enable the generation of alerts or reminders. I was on a conference call with a client the other day, and we were talking about the involvement that Siri can play on a cell phone, and the involvement that Siri can also play on the iPhone. So for example, when I lose my cell phone, which I do often because I'm a walker and a thinker, I will ask my iPhone to find my, my phone. And so Siri will do that for me. We can do the same thing with Alexa, and we can also do the same thing with Google. So how we are using those active technologies to help generate alerts as well as reminders and helping us find lost objects, positioning our patients for greater success with medication management, as well as finding something as simple as a remote control. So attaching technology to the remote control. I mean, how many times have we been in a situation where one of our patients fell by simply getting up to go find the remote control? To whereas the passive component to those technology elements are more of the background components, the triggers, the warnings. Also think of how Alexa can help to turn on lights in the morning or turn off lights in the morning. How Alexa can also, you can ask Alexa to tell you if the front doors have been locked, and if not, then to lock the doors. So both of those components together can really help to create more of a social interaction within the home that creates self-confidence, more awareness and more connectivity. The other component when thinking about passive technologies are sensor-based components. So things that can be plugged into a wall and also positioned outside of the home. And so these sensor-based technology components will enable us to track the number of visitors that are coming in and out of a home. It will also help us to identify the amount of time that's spent with inside the home or even sedentary behavior. What I really like about the passive sensors is they learn the patterns of our patients. They learn the patterns of our loved ones. So if our patients typically get out of bed around 6:30 a.m. and the sensor alerts and communicates with the provider or communicates with the family member that mom or dad or our patient is still in bed and it's 7:30 or 8 o'clock, it's going to prompt that alert so we can have that action of response time instead of a couple of days later. And so it can also alert us as it relates to visitors. When we think about the communication with our family members outside of the patient, him or herself, it can also provide confidence and a level of comfort for the family knowing the visitors who are coming to take care of, and the same for the provider. So it's really about us adopting, the care at home industry adopting technology that has a mixture of this active and passive components. So it can be viewed as part of the solution to what we are facing as it relates to workforce scarcity. The other thing that we need to keep in mind as it relates to tech-enabled solution, I like to call it the network, right? So how do all of these elements come together to better assist you and your organizations with what we opened up with, the recruitment of staff, the retention of staff, and the overall patient engagement? So really, it's the litmus test of our EMR. So how does our EMR support our capabilities of managing not only the interworkings, the operations of our day in and day out, but also how it helps us to deliver that care at an extremely elevated level. So when I think of an EMR, first thing that comes to mind is the ability for upskilling and providing that professional development. So how does the EMR adopt technology components to enable individuals to work at the top of their license and or their certification within the role or the function that he or she has chosen to do? So that particular upskilling and professional development, will then enable them to have a different patient engagement experience. The other area of opportunity here of tech-enabled solutions is how we are scheduling that staff. And so scheduling optimization components embedded within an EMR solution not only helps from an operational perspective, but it also helps the engagement of the employee and then ultimately the patient's experience. And so scheduling can be based upon the availability of the employee. So if I was to, in essence, sign up as a PRN, I'm working in a gig economy, and I have access to utilize an EMR solution, I have the ability to say that I'm only working on Mondays and Wednesdays. And through this time period, I'm only available between 1 o'clock and 6 o'clock. And so the tech-enabled solution would be able to identify Christina Andrews as an employee of choice based upon my schedule and time, so we can optimize the ability to say yes, to that patient and family who needs our care. The other thing too is the optimization of routing. So when we think about the service areas, in essence, that organizations provide care to, how do we effectively deliver that care? And how can the EMR solution or technology ecosystem help to optimize staffing to manage costs and also improve patient experience? And the third thing that comes to mind is, I feel also extremely important, is the clinician on the shoulder, as I call it. So it's the guidance throughout the solution, and that also considers the interoperability, connectivity to the solution at large. How does those components provide guidance to the clinician while he or she is providing care, and elevates that care delivery, in a robust fashion to give them the level of confidence based upon the competence that they're receiving. So when we move, that component and we couple it with the telehealth or the telemedicine, that technology allows a patient to not only consult with their healthcare providers, but it also allows them to consult to the care at home providers, right? So utilization of video conferences or phone calls or messaging. The telehealth can eliminate the need for patients to travel, as we all know. It was extremely beneficial during the pandemic. So when we think about the generations that we are serving today, baby boomers are much more attuned to technology and the use of technology for their care delivery than where they were prior to the pandemic. And so this enables and promotes more of an independent comfort of being able to manage their care, within the home setting. The telemonitoring devices, which I just talked about on the previous slide, peppering that into the patient's environment, really can help us capture the important data to manage this entire network. So assistive technology. I want us to think about the assistive technology as electronic gadgets. So I already mentioned the cell phone, I already mentioned the iWatch, so these gadgets are going to operate as virtual assistants. So when we go in to assess a patient's environment, are we also assessing what assistive technology they already have, right? So this is not always just about the organization adopting the technology to where they have to purchase certain things, but it's also about incorporating what the individual may already have in his or her own home. And so these virtual assistants, can provide visual communication aids, memory aids, setting medication reminders, as well as pill dispensers. It can also be used for home safety and security. We today have smart smoke alarms, right, in our houses. Most of us do. And when the batteries have to be changed, it's kind of interesting how you get those things out of the wall. But anyhow, that's a whole nother story. But even our doorbells now, that's assistive technology. I have the ability to talk to anyone who comes to my door, through Ring doorbell. So once my parents get to an age, I will be installing that, although I'm sure they will say no. So I can help to manage, that care delivery from afar. It really helps us to create that interconnectivity. Personal alarms. We've all heard of the pendants. Some organizations have adopted those wearable pendants that help that patient contact the emergency team and also communicates with the care at home agency when they fall. Telecare systems. It only sounds when they detect something out of the ordinary that's wrong. So for example, if they don't get out of bed, or if they leave the front door open, or maybe they're in the kitchen too long. So these telecare systems, it's a digital activity monitoring component that looks for the outliers within the daily activity. GPS trackers, which are worn on the body. These can be fobs, they can be wristbands. So it doesn't make the patient or your loved one feel uncomfortable about the new jewelry that they are wearing. But this can be very important, especially for patients who have dementia or Alzheimer's, wanting to remain in the home and they want to go for a walk. So it enables us to know where our patients and our loved ones are at all time. Memory aids. Forgetfulness is it's a part of aging. It's part of the process, and it doesn't necessarily have to be correlated to a symptom of dementia. There are many assistive technology devices that are designed to help remind that the mom or dad, to remind our loved one, it's time to feed it's time to feed the cats. It's time to let the dog in. Remember you put your keys at the front door in the glass bowl. So again, it helps to empower them to feel more independent in the home, and it reduces their frustration, because we know that frustration leads to other elements within the care plan, it increases risk in other elements of the care plan. So it helps to reduce their stress, that they don't need in their daily life as they're aging. So other assistive technology, visual aids, screen readers, communication aids, so when we think about, the ability to read, components on a computer or a technology, or even on the smartphone, these technologies can help minimize impairment. So elderly individuals can continue with their daily lives, reducing stress, improving engagement, improving that interaction, especially when it comes to the use of telemonitoring and telehealth devices. So really, at the end of the day, when we couple all of this with business intelligence, it truly empowers the care at home organization to have the right data at the right time, improving not only the competencies of the staff, but also the overall patient experience, because it's all interconnected. Last but not least, the other element too I want us to think about as it relates to tech-enabled solution is the patient portal. So patient portals really help us to coordinate the overall communication of care delivery. When I think of old school patient portal, what comes to mind for me as I chuckle is the 3-ring binder. I mean, how many days did I spend putting together the brand of the organizations that I supported, in that plastic portion of the 3-ring binder, and making sure I had all of the admission information and medication information and the care plan information, the care team information, and if we had private duty involved, and then who the doctor was. That was a lot of time. That was also an expense. And so patient portals really help to provide that tech-enabled solution of communication so we can keep track of our mom and dad's care and their overall test results and billing and prescriptions and so on. So this is the network that really helps to elevate the care at home industry so we can do what we love doing, improving patient care. So technology has improved diagnostics in every way, from accuracy to speed to accessibility. I know each of us can think back to when we first started in the care at home industry, and we can look at today and the advancement in technology that facilitates that communication and coordination and collaboration. Diagnostic technology plays a key role in addressing one of the biggest issues in our healthcare system, which is chronic illness. So when we think about the top 2 chronic illness disease, first is heart and the second is diabetes. Technology can help to reduce the severity. I know I'm preaching to the choir here, but I also want us to think about how technology can be helpful in the terms of the caregivers. How do we place technology and allow it to come alongside of the caregivers in a different way? Even if we start to think about, instead of a laptop going into a patient's home, what about a cell phone? When I think about 2025, 75% of the workforce will be made up of millennials. And how many millennials do you see walking around today with their cell phone? So the ability to provide patient care through different forms of technology impacts employee engagement, impacts the overall patient experience. It creates that collaborative communication. It fosters that collaboration, not only just with the internal components of an organization, but it threads throughout so many other areas, right? When we think about our payer, when we think about our referral partners, in addition to the family, all of that is interconnected. And so technology really has enabled us not only to improve and elevate that care delivery, but the overall diagnostics. So the other thing, as we lean into the next few slides, that I want us to consider as it relates to technology is how does it come alongside of the lifeline of an organization? And what I mean by the lifeline of an organization basically boils down to one word: outcome. So the outcome of the overall experience. So by keeping our patients in their home, reducing emergency care, hospitalizations, improving quality of care, and the end-of-life experience, this impacts the perceived patient satisfaction and family satisfaction. And that is elevated through the use of technology. Your organization's quality and patient survey results impacts two key areas of operations. First is your referral growth, and then second is your value-based performance rate adjustment. So when we think about that quality and that star rating, how many times have you used Medicare.gov to research a local home health or hospice organization? Just today, I received a text from my husband, whose friend reached out and said, listen, I need hospice for my mom. So he knows this is kind of my shtick. He's like, what was that site again? So I texted him the Medicare.gov, but I clicked on, find a provider, and I said, just have her scroll to hospice, put in her zip code, and she's going to have all the information she needs to make the first decision. We know that the second decision will be based upon that in-person interaction. So family and patient satisfaction, that overall quality outcome, it is going to be the lifeline of your organization. And so when we think about technology and how it trickles throughout all of these components on the slide, it makes a big impact, from timely intervention to the alignment of staff, which we talked about just a few moments ago, helping to standardize, care processes into clinical best practices because of the clinician on the shoulder, but also that focused training. So when I think about focused training, I get a little excited about this area, just because, when we think about the generations that are working alongside of each other, which right now we have 5, each of them play a pivotal role in focused training. So not only are we onboarding new generations into the care at home industry, but we also have a mentee mentorship type program within organizations. So those who have been in the industry for such a long time, how we're utilizing that generation to educate the newer generations, but how we're utilizing the newer generations to educate the older generations for adoption of technology. So focused training really helps to improve operations and directly correlates with employee upskilling. It directly impacts the organization's ability to drive and to elevate care. And so we recently conducted a survey, which I'm going to talk about here in just a moment. And what I found interesting within this survey is that organizations are thinking about reasons, primary drivers for technology investment. I love that. Back in the day, I had pain points within the technology that we used within our hospice and home health organizations. And so, thinking throughout the years and becoming a bit more aware, why do organizations need to adopt and invest into new technology? Well, one of the components is focused training. It's top of mind of how we can train and upskill our employees, because that can be truly a differentiator for an organization, focused training through the use of technology. If an individual is attracted to your website, how are you communicating to that individual once he or she applies the type of technology they will be using to support their role, their function? How are you also assessing how that technology is impacting employee engagement, which also impacts employee retention? So the top 3 primary drivers for technology investment based upon this survey, first was operational improvement. So when I think of operational process improvement, it's everything that's sitting on this slide right now, right? So 49.7% of the respondents indicated, I think I need to adopt new technology to improve my operations. 44% of the respondents said, I know that if I adopt new technology, it's going to drive employee engagement as well as retention. And 42% 0.7% said that this technology needs to provide the training and the upskilling so we can improve patient satisfaction. So when we think about that network, that ecosystem on the previous slide, there's so many areas of opportunity as it relates to driving that type of technology to improve overall outcomes, which ultimately is going to position your organization for a greater success. So impact on operational efficiency, when we think about revenue, we think about cost, we think about streamlining operations, ensuring compliance, and improving patient outcomes. This survey did exactly that. I mean, it really highlighted, why there is a focus as it relates to the recognition and adoption of technology and the key role that it will impact addressing many, many challenges. So this survey was conducted in conjunction with the Council of State, Home Health and Hospice Association, and the Forum of State Associations. And so the top challenges that we know that the organizations are having to lean into, and each of you most likely are feeling today, number one is staffing. That's not going away. There are conversations right now that there is a pool of population that can help bridge that gap to our staffing scarcity. But really, how are we attracting that pool of population into the care at home industry? How are we dangling that carrot of opportunity so we can reduce that workforce scarcity? So we're going to continue to lean in to staffing as a challenge. Changing payment dynamics, number two. So that's the second key challenge. And so when we think about the changing payment dynamics, how does the adoption of active or passive technology, telemonitoring, telemedicine, how does that position an organization to have a seat at the table instead of being on the menu? So if changing payment dynamics is a concern of your organizations today, I would encourage you to think about the adoption of technology and what your key drivers are, so you can position yourself at the table to have those payer conversations. The other area of concern is regulatory and audit scrutiny. And so when we think about audit scrutiny, how does technology provide the upskilling, the onboarding, the ongoing education, and that clinician on the shoulder? So we are documenting as best as we can through the guidance of technology so we can reduce that audit scrutiny risk. Because when I think about being in the midst of an audit, which I'm sure the virtual room, you can raise your hand and say either you're there today or you've been there, it impacts employees. And when it impacts employees, it impacts the patient care. So again, it really boils down to that domino effect. Last but not least, which I've talked about a few times too, the other key challenge, as it relates to operational efficiency, is maintaining employee engagement. So when we think about the top three primary drivers, it really makes sense of why the respondents said we need the operational process improvement, but it has to start with employee engagement, and then it has to continue with training and upskilling. Because really that leads your organization to an opportunity of growth. It provides that competitive advantage. It enables your organization to have expansion within service coverage area, in addition to service diversification. So when we think about the patient population amongst your communities, what do they look like? What does the claims data present? What are the top three primary diagnoses? What does the rehospitalization rates look like? What do the deaths percentage look like? When you couple all of that information together, what type of service line delivery do you need to invest in to manage that patient population? And by investing in that, that type of technology to manage that patient population, how do you position that then for that seat at the table with the payer, so you can continue to expand upon your service coverage area, because ultimately that will provide for new partnership opportunities. So when you think about the yield on investment as it relates to technology, just keep in mind that many of your partners down the street within the care at home industry are thinking about this today, and they understand that the greatest yield of investment into technology, number one, is employee engagement. 47% of the respondents indicated that. Secondly, staff training technology at 45%, not just staff training, but staff training technology, and then how that impacts overall patient engagement at 36%. So I will leave you with those statistics and the resources to present the technology enabled solutions today. So I appreciate your time and your attention, and I will open it up for any questions. Thank you.
Thank you, Christina. I don't see any questions in the question panel, but we'll give folks just a second in case they want to pop something in there for you. But nice job, as always. I just, technology is amazing. You know, this will be a totally different presentation 1 year, 3 years, and 5 years from now, but it'll just continue to blossom, you know, into AI and all kinds of things we can't even begin to imagine yet. But I thought you had some great points. It really touches on every aspect of what we do, from the patient to the caregivers to the families to the referral sources. You know, it's no one's immune from the technology enhanced changes. So it's all interesting and important stuff. So, well, I don't see any questions, so let's go ahead and let people get on with the rest of their day. But again, thank you very much, and please reach out to Christina's email is candrews@axxess.com, and again, mine is mcarr, C-A-R-R, at axxess.com if we can help you with anything. Take care.
Thank you, Mike. Thank you, everyone. Take care.
Thank you for joining our on-demand training today. Axxess is the only home healthcare technology company approved by the American Nurses Credentialing Center to offer continuing education credits and the most recommended home health software on Software Advice. You can watch more on-demand training videos through our industry-leading help center or at axxess.com, where you'll find tutorials, blogs, white papers, and answers to frequently asked questions. Axxess, empowering care anytime, anywhere.